Elham Bazshahi, Kurdistan, from Kurdistan University of Medical Sciences, Iran. Adherence to plant-based diet during pregnancy and risk of gestational diabetes. A prospective birth cohort study. Ms. Elham Bazshahi, please share your presentation.
Thank you. Do you have my voice?
Yeah.
According to the weak connection in my country, I've sent my recorded presentation. Thank you.
A dietitian of Department of Community Nutrition, Kurdistan University of Medical Sciences. I'm going to talk about adherence to plant-based diet during pregnancy and risk of gestational diabetes, a prospective first cohort study. If you don't mind, I'd like to leave questions until the end of my talk. This presentation is structured as follows. As we know, gestational diabetes mellitus (GDM) is a common complication affecting 1 to 30% of pregnancies worldwide, including 14% of pregnancies in the US, 5.7% of pregnancies in Australia, and 5 to 10% of pregnancies in Asian countries. In Iran, the prevalence of GDM is estimated to be about 3.4% of total annual pregnancies. The incidence of rising pregnant women of GDM across the world is partly due to the concurrent increases in well-known risk factors like advanced maternal age, pre-pregnancy overweight or obesity, and family history of diabetes. Women with GDM are at greater risks of several complications such as preeclampsia, type 2 diabetes, high blood pressure, and CVD. Also, children born to mothers with GDM are at greater risks for overweight or obesity, impaired glucose tolerance, and metabolic syndrome later in their life. The term plant-based diet represents a wide definition as it could either partially include a limited amount of foods derived from animals, such as the Mediterranean diet, or contain only plant-based foods like fruits, vegetables, and legumes, as seen in vegetarian and vegan diets. Previous studies about the health effects of maternal plant-based diets have mainly focused on vegetarian diets. In general, people adhering to vegetarian dietary patterns tend to avoid some or all the major animal foods in their dietary choices. Therefore, the General Plant-Based Diet Index (PDI) has been created to compensate for this limitation. PDI evaluates the degree of adherence to a diet rich in plant-based foods and food groups. Hence, PDI is associated with a reduced risk of type 2 diabetes in the general population. Therefore, the purpose of this prospective cohort study was to evaluate the potential relationship between PDI and risk of GDM in a sample of Iranian women. This prospective cohort study was conducted within the framework of the Persian Prospective Epidemiological Research Studies in Iran birth cohort. Pregnant women who lived in Semnan, a city situated in central Iran, were selected for this study during 2018 to 2021. Inclusion criteria were within the first trimester of pregnancy, irrespective of gravidity, parity, or use of fertility treatment, to have resided in Semnan for at least 1 year, and plan to give birth in a hospital located in Semnan. All pregnancy outcomes, regardless of whether they resulted in a natural vaginal delivery or cesarean section, were included. The criteria for excluding were twin gestations and hormone-related disease or hormone therapy. In all, 1,024 women agreed to take part in the study. Of those, mothers who didn't complete dietary questionnaires during the first trimester, those who didn't continue the study until the end and had incomplete information about these study outcomes, mothers with total energy intake outside the range, those who used cigarette smoking, and had a history of GDM were also excluded from the analysis, leaving 635 pregnant women for the present study. A 90-item food frequency questionnaire was used to evaluate the participants' dietary intake during the first trimester of pregnancy. We calculated PDI scores using the method introduced by Martinez. We classified foods into 3 food groups according to the characteristics of nutrients and foods, including healthy plant-based foods, less healthy plant-based foods, and animal-based foods. We ranked food groups into deciles and gave positive or reverse scores to each food group. All tests and medical records of mothers separately for the first, second, and third trimesters were taken from the mother at 38 to 39 weeks of pregnancy and scanned in the system. Criteria for diagnosing GDM was based on an oral glucose tolerance test, elevated blood glucose levels, and symptoms of diabetes in a pregnant woman who hasn't previously been diagnosed with diabetes. Having at least two of the following criteria was considered as a diagnosis of GDM. Structured pre-tested questionnaires that were developed for Persian-based cohorts were used by trained interviewers to obtain information about the characteristics of the study participants, and IPAQ to evaluate physical activity levels. Anthropometric measures were
Sorry, I think
measured by
my
the
presentation is stopped.
I was calculated based on the weight in kilograms divided by height in meters squared. Firstly, we classified study
No,
participants
it's
across the
going on.
totals of these scores. Secondly, we compared the characteristics of participants across categories by performing ANOVA for continuous variable and chi-square tests for categorical variables. The hazard ratio and 95% confidence interval of GDM were calculated by utilizing both an ANOVA test and a Cox proportional hazard model for each category of the plant-based dietary indices. Multivariable analysis used for confounders. Let's look at the results. General characteristics of the study participants across tertile of PDI, HPDI, and UPDI scores are shown in Table 1. Pre-pregnancy BMI, pregnancy order, and have-NOSA were significant across the categories of each score. No other significant differences were observed in terms of other general characteristics across the scores. This table illustrates the dietary intakes of the study participants. As you can see the significant differences between categories. In Table 3, after adjustment for multiple confounders, there was a significant association between PDI score and risk of GDM. In addition, third compared to the first tertile of HPDI score was associated with a lower risk of GDM in both crude and multivariable adjusted models. With regards to UPDI, there was a significant association between UPDI and risk of GDM in the crude model. However, this association became non-significant after adjustment for potential confounders. In this prospective first cohort study, we found that being in the third tertile of PDI was associated with a 45% lower risk of GDM in Iranian women. In addition, women who were in the third tertile of HPDI had a 7% decreased risk of GDM compared to those in the first tertile. There was no association between UPDI and risk of GDM. To our knowledge, only a limited number of observational studies have investigated the association between adherence to plant-based diets during pregnancy and risk of GDM. A prospective cohort study among 2,099 Chinese women suggested that greater adherence to a plant-based diet during the second trimester of pregnancy, as assessed by the overall plant-based diet index, was associated with a 57% lower GDM risk. A meta-analysis of 14 epidemiological studies also indicated that adherence to vegetarian diets may be associated with a 27% lower risk of type 2 diabetes. A plant-based diet is characterized by high intakes of dietary fibers, antioxidants, and micronutrients. Evidence from the experimental studies has shown that viscose dietary fibers and postprandial glucose metabolism immediately by slowing gastric emptying rates. Likewise, the products derived from dietary fibers by macrobiota, example short-chain fatty acids, are known to reduce liver glucose output, improve fat hemostasis, and affect gut microbiota. Antioxidant compounds, including polyphenols, naringenin, and vitamin C, can also improve insulin sensitivity, inflammation, and oxidative stress associated with GDM. Simultaneously, a plant-based diet has less saturated fat and animal protein, which may adversely affect insulin sensitivity. All of these possible biological mechanisms help explain why adherence to a plant-based diet could be linked to a lower risk of GDM. In conclusion, our findings suggest that adopting a plant-based diet during early pregnancy may be protective against GDM among the Iranian population. To confirm our findings regarding the association of plant-based diet patterns with GDM, further large-scale cohort studies are needed. Thank you for your attention.